Hello and welcome back to Fun with the Chiropractor. I will be your host, Dr. Carpenter. Today we are going to discuss Graston. Graston is something that I'm certified in, and we have seen a lot of progress with our patients when we use this technique. As you can see, there's many different shaped instruments through here, and each of these instruments is shaped differently to help with different areas of the body. This bigger instrument is great for working through thighs and also even through lower backs. We have an instrument here that's great for forearms when people have tennis elbow or golfer's elbow. We even have a smaller tool that's great for working through wrists, through knuckles, working through fingers. And then we have different instruments here that we'll be showing you today. So today I have a great model down here named Brianna. I'm going to be showing you how we're going to be grasping her lower back, and I'm also going to show you how we're going to grasp in her feet today as well. Now, the best thing to do is post-adjustment is to really get in there with a tool, and the point of this is to, one, increase the circulation to the area, which will help push out the inflammation, and then also we want to break up any adhesions or scar tissue in the area. So I've already put coconut oil down, and that's just going to help lubricate the area so I can work through it. So the big thing with these tools is they're made to first scan the area. They're a stainless steel type of instrument. And because it's stainless steel, you can really feel when it vibrates or moves more, telling you that there's something wrong in that area. Another thing is the skin naturally gets really red where there's a bigger issue. So just me doing that little bit of scanning there, yes, the whole area is red, but I can actually see increased redness right through here. Now, after I've scanned, I'll actually get in there, and there's a couple different techniques you can do, but I'll go along that spine, making sure that I'm getting right along those muscles that help strengthen and stabilize the spine. And also we like to get deep, and there's little tiny ligaments called interspinous ligaments that go between each bone. So I'll actually get in between and I'll work out those as well. And the patient, after they're done, they actually feel better. They can feel less inflammation in there. They can feel more range of motion. Sometimes you can get some bruising through the area, and that's just because of part of the healing process. So we really make sure to let you know that you can feel sore, and if you do, you can put ice on in the area. The other area I'm going to show you here, I'm going to have Brianna go ahead and turn that over for me. A common thing that we see here is plantar fasciitis. Plantar fasciitis just basically means the tissue on the bottom of the foot isn't functioning like it's supposed to. So I'm actually going to grab a different tool, because we always want to scan the area first. And if you want to come and bring it right over here, I'll actually scan through that tissue, and it can be very, very tender. And so with each patient, you want to make sure that you go at an intensity that they can handle. And through consecutive sessions, we'll be able to get in there deeper and work through the layers. But if I work just with her foot like this, I'm getting one layer, but as I bend her foot back, you can actually see the arch come right through there, and I can actually work that deeper. And she has quite a spot in there. I'm sure she can feel that. Now, if that noise that you're hearing, like gravel, is unhealthy tissue. So with Brianna, I would probably stick with this instrument for quite some time, but when we want to get a little bit more precise or specific, I can actually work across that ropey adhesion that she has right here, and then help get that tissue healthy again. So one thing, Graston is really going to help that tissue. Combine that with adjustments, that's going to get the joints moving better. And then we have different things like orthotics, rock taping, or kinesiology taping that can also help. So I hope that was informative. I hope you guys have a great day. Thank you.